This is Dr. John Wycoff. Welcome to another edition of Pathways to Wellness with yours truly, Dr. John Wycoff. I'm a board-certified family physician, but I don't practice family medicine. I left that world decades ago, and I now consider myself a functional medicine specialist. What does that mean? I integrate the best of the alternative world with the conventional world to try to get you on a path to health and wellness, and we try to emphasize more natural solutions. Does that mean I don't prescribe medications? No, I prescribe medications each and every day. Do I only use supplements? Well, I do use supplements. But we also talk about lifestyle changes. We help you understand the root cause, and we look for the root cause of your disease. So today's topic, we're going to talk about why am I losing hair? And you might say that's a little bit funny because it's happened to me. I've lost my hair. But it's one of the most disconcerting symptoms that I see in men and women, but especially women, as they age, as their hair starts to thin. And it's very, very disturbing. And they go to the doctor and they say, well, I don't know. So we're going to dive in depth to hair loss and try to understand what causes hair loss, and what you can do and how we approach that at Wycoff Wellness. So we'll call this topic, Why Am I Losing Hair? Again, I'm Dr. John Wycoff, founder and CEO of Wycoff Wellness, 1226 Michigan Avenue in East Lansing, Michigan, wycoffwellness.com, 517-333-7270, 333-7270. So hair loss, common symptom that people complain of. So when I do a history, the first thing I look for is medications. Medications may be the most common reason people have hair loss. And you can do a very simple Google search, type in the medication you're taking and put medication X and hair loss and see how often that's reported. If it's reported more than 5% of the time, you have to at least consider that as an issue that may be driving your hair loss. So medications, oftentimes the hair loss, and they can be any medication. People always think of chemotherapy. It can be a statin drug, it could be a blood pressure drug, it could be a diabetes drug. So many medications have hair loss as the reason. It's just the medication side effect. So don't be concerned that it may be something as simple as that. Birth control pills, thyroid medications, especially too much, hormone medications, antidepressants, blood thinners, blood pressure medication, mood medications, antidepressants, weight loss medications, antifungals, cholesterol-lowering drugs, arthritis medications. It runs the gamut that are associated with hair loss. So in my practice, the second most common thing I see is related to hormones. And really each of these hormones could be a podcast. So we're going to talk about hormones individually: thyroid hormone, female, male hormones, adrenal hormones, and the big hormone, insulin. All of those hormones oftentimes have hair loss associated with them when they're out of balance. And why do they get out of balance? Well, we age, we live in America, our genes, nutrients, things are driving them out of balance. What we're going to do, instead of just saying, listen, take some minoxidil to thicken your hair, we're going to delve into this deeper, do a deep dive. What is causing this? Let's talk about thyroid hormone. If you're fatigued, brain fog, gaining weight, constipated, dry skin, losing hair, you may have hypothyroidism, or at least functional low thyroid function. Now, oftentimes you go to the doctor and he does a TSH test. No, you're normal. Well, the TSH test is really not even a thyroid test. It's a test related to your pituitary function, and it's got a wide range from low to high, a 20-fold range. So you need to interpret that test. Is it in the optimal range? Do you have clinical hypothyroidism? To do that, you need a complete and comprehensive thyroid panel, TSH, free T3, total T3, free T4, total T4, thyroid antibodies, maybe a reverse T3 uptake test. We get those each and every time we do a thyroid panel on our patients. We do a comprehensive thyroid panel. It's important to have all of those tests, as oftentimes one test does not show the problem. So get the right testing. If you need to be on thyroid replacement, what we work with our patients is bioidentical thyroid replacements like NP thyroid, Armour thyroid, Nature thyroid, and there's some pros and cons to which one and pricing. We will help you make that decision. But I try to keep people away from the synthetic thyroid like Synthroid, levothyroxine. I think that they just don't do the job that we want to do. So thyroid assessment is critical. Next is adrenal hormones. The adrenal hormones are made by your adrenal glands, your stress hormones. There's two, cortisol and DHEA sulfate. They can be measured in a blood test, or more accurately, we do a saliva test. We do a saliva collection 4 times during the day and measure cortisol level. We measure DHEA in the morning, but we measure cortisol in the morning when you get up, usually about 4 hours later at noon, usually about 5 p.m. and at bedtime. And we look for this circadian rhythm of cortisol to tell us if your cortisol level is functioning like it should. That's a very common reason people have hair loss. And if we can determine that, we can help support your adrenals, usually with supplements, maybe stress reduction, maybe diet, get you on that road to healthier hair. Speaking of diet, that's another common reason that people have hair loss. If they're on a crash diet or they're rapidly losing weight, oftentimes their hair will thin. They're not getting the nutrients they need out of their diet. So if you experience rapid weight change and you're losing hair, maybe we've got to look at your diet. Are you getting adequate protein? Are you getting the nutrients that you need for healthy hair? We'll talk about nutrients in a little bit. So back to hormones are the sex hormones for both men and women. These oftentimes change and start to fluctuate in women in their 30s and men in their 30s. It can be very slow. It's not oftentimes very dramatic, but you'll start to see more production of a hormone called dihydrotestosterone, DHT, and you'll see a decline of the female hormones and male hormones, estrogen, progesterone, testosterone. That imbalance sets you up for hair loss. So come in and we'll get the testing. For the sex hormones, we normally will do a saliva test. Again, we just need a 1 vial saliva. We can check all of the sex hormones, but oftentimes we'll combine it with the adrenal hormones and we'll get a 4 vial collection, and we'll order both the sex hormones we want, usually the 3 different estrogens, estradiol, estrone, estriol, progesterone, testosterone. And then we'll get the 4 cortisols and a DHEA, a very comprehensive hormone assessment and most accurately reflected by saliva. You can do blood testing, but they're very, very hard to interpret. They fluctuate tremendously. And if I have the choice, I'm going to do saliva. So those are the basic, and the same in men, we may just do blood, but we get a testosterone total and free. It's important to get both. We get an estradiol level, because oftentimes men begin to convert their testosterone to estradiol, and we can very effectively block that conversion with diet, supplements, or maybe even medication with an aromatase inhibitor. So the last hormone we're going to talk about is maybe most important hormone, that's insulin. People don't always think of insulin as a hormone, but it is really the master hormone that controls your blood sugar. People that have polycystic ovarian syndrome or something called insulin resistance syndrome, metabolic syndrome, almost always have thinning hair. The hair thinning can be marked. You probably have seen this in women who are a little bit overweight as they get into their 60s, 70s. They become almost bald. Their hair is so thin. If they might have a little facial hair, a little bit of hair on their upper lip, chin, maybe hair on the breast. and they're struggling to lose weight, especially around their bellies. They have PCOS, and they're easy to spot. They'll have thinning hair, facial hair, obesity, and if the right testing, you can determine how significant their PCOS is, and then you can address that problem. Maybe it's a GLP-1 drug. Maybe it's just diet or exercise. Maybe it's supplements. Those are beyond the scope of this discussion today, but there are podcasts that I have on the GLP-1 drugs and PCOS that I encourage you to listen to that do deeper dives into each of these areas that we're talking about today. But PCOS is a very common reason for hair loss. We talked about diet. Again, if you're not getting enough protein in your diet, and I mean a significant amount of protein, upwards of 1 gram of protein for 1 pound of ideal body weight. So if your ideal body weight is 160 pounds, even if you weigh 200 now, you need 1 gram per pound. You need 160 grams of protein. That means you've got to have 4 meals a day of protein. A high-protein breakfast, a high-protein dinner, and probably a high-protein snack and maybe a protein shake snack to get anywhere near that amount. So if you don't have kidney or liver issues, high-protein diet will help your hair. It'll also get you the nutrients you need. It is appropriate to take nutrients for hair loss like vitamin D, biotin, zinc, magnesium. But one of the ones that's very common, which is not known, is iron. Many women who have low iron and women that are still premenopausal and they're cycling every month, they oftentimes develop some mild iron deficiency. Have your doctor check your iron, check a ferritin level, and see what they're doing, and make sure you get control of your cycles. That usually is a sign of hormonal imbalance, so that saliva testing we talked may also help you with that issue. So diet, supplements, oftentimes at Wycoff Wellness, we will measure your supplements. We have a specialized test, a biomedical test called a SpectraCell MMT, micronutrient test. It's a random blood test, but it gives us a quantitative evaluation of 33 of your key nutrients. We get it mapped out one by one, whether you're getting enough, whether they're borderline low, whether they're very low. And then we can fine-tune recommendations for you. So a patient with hair loss, with no obvious reason, a micronutrient test may be very helpful. You have to have a healthy gut biome. The bacteria in your gut must be healthy. If we're not sure, we'll get a digestive stool analysis and look at the bacteria, the good and the bad bacteria in your gut, and determine how you're absorbing nutrients. Do you have a absorption problem? That can also affect your hair quality and hair strength. We're going to balance your hormones, because really hair loss is a symptom of things out of balance. So if we can find out what's causing the teeter-totter to tip, we can bring it back to a better level and get your hair growth back to normal. Certainly you can have excessive hair styling, excessive pulling on the hair, chemicals on the hair. That's another reason. Some people, that's a big deal for them. Not too big a deal for me, but some patients, they're really into their hair. So be careful. Certain shampoos, certain hair products can promote hair loss. So be careful with what you're doing to your hair if you have thinning hair. Diet, lifestyle, stress, lack of sleep, all are contributory to hair loss. So the bottom line is, if you have hair thinning or hair loss, there probably is an identifiable cause. You just have to find somebody that can help you with that cause. And that's what we do at Wycoff Wellness. So it'd be a privilege to see you, as a patient. We can see you in the office. We can oftentimes do virtual visits too. We can schedule a Zoom call or a phone call or a follow-up by phone virtually. All you need to do is contact our office. Our website is wycoffwellness.com, or give us a call at 517-333-7270, 333-7270, 800-471-0255, 800-471-0255. We're happy to answer questions about our approach to hair loss or anything else, because what we do at Wycoff Wellness is functional medicine. We can try to find the root cause of your problem, whether it's fatigue, sleep, anxiety, weight gain, even things like cancer, high blood pressure, diabetes, neurodegenerative diseases. Let's get you on that path to health and wellness, and we're probably going to look for natural reasons. That's what we do at Wycoff Wellness. Hair loss, very common in men and women. So guys, don't be distraught. We can oftentimes sort out why you're losing the hair. We can do some natural things, whether it's blocking DHT production, whether it's blocking the enzyme aromatase and estradiol conversion, whether it's diet, nutrients, get an MMT test, get a digestive stool analysis. You just have to have the right tools. And what I have is a bigger toolbox at Wycoff Wellness. So that's a wrap on hair loss. It's a common issue, one that we see often, one that's very disturbing for men and women. And I hope you take it seriously. And if you get blown off by your primary doctor, come see me, Dr. John Wycoff at the Wycoff Wellness Center in East Lansing. We'll try to figure out the problem. Keep listening.